Welcome to the Ubuntu 2024 podcast. I'm your host, Dr. Joe Scott Jones, a rural GP based in New Zealand. The word Ubuntu comes from the Zulu and Xhosa languages and can be roughly translated as humanity towards others, the belief in a universal bond of sharing that connects all humanity. I am because you are. Ubuntu 2024 is an in-person and online conference jointly held by the Network Towards Unity for Health, TUFH, and Rural WONCA, the World Organization of Family Doctors Working Party on Rural Practice. Ubuntu 2024 will be the 45th anniversary of the Network Towards Unity for Health and bring the TUFH annual conference together with the 20th WONCA World Rural Health Conference. So it's pretty exciting. Ubuntu 2024 is going to be hosted by 5 partners: the University of the Western Cape, University of Cape Town, Stellenbosch University, Cape Peninsula University of Technology, and the Western Cape Government Department of Health and Wellness. In September, Cape Town, South Africa, will see Ubuntu 2024 bring together health professionals, educators, and thought leaders from across the globe to explore the theme of people, place, and policy for community wellness. And today I'm talking to Dr. Nicole Brooks, who's the acting dean of the Department of the Faculty of Health and Wellness Science at the Cape Peninsula University of Technology. Tell us a little bit about yourself, Nicole. Good morning. It's evening here in New Zealand, but yeah, good morning. Hope the weather's good there.
It's perfect. Starting early, it's just after 8 in the morning. Really pleasure to be here. It's a first for me being part of Ubuntu. We've recently got on board as CPUT in 2023. I am Nicole Brooks, the acting dean of the Faculty of Health and Wellness Sciences at the Cape Peninsula University of Technology. So we are the only technological university, and the 3 other are the comprehensive universities in Cape Town.
What's the difference between a technology university and a comprehensive university?
Our students undergo work integrated learning from as early as year 1. So we have the theoretical components, and they go out into industry, to the hospitals, to the clinics on the various platforms to gain exposure to industry as early as first year. So that is the difference. When our students leave and graduate from CPUT, they leave with a qualification and they are experienced, so they can just hit the ground running in the workplace. So that's what is different between us and the other 3 universities as part of Ubuntu. So I just tell you a bit about myself, where it all started for me. So I started at UWC. I've done all my qualifications at UWC, starting with a Bachelor of Science degree. That was my initial qualification. I was then meant to be a teacher. I then moved on and progressed, did my honors, a specialty in physiology, and then I started my master's degree in physiology, reproductive physiology. I then went on to do a teacher's qualification thereafter, and ended up in the school teaching life science, biology, mathematics. It was in 1997 for 2 years. So that was a calling, and that was probably, I was meant to be an educator, but I thought to myself, you know, I'd rather want to continue, do a PhD, and get into a university. So I then pursued and started my PhD. And I then joined Cape Technicon at that stage. When I started, we were called Cape Technicon. It was 2 Technicons in the Western Cape. I joined them in 2001, actually. I was then teaching anatomy and physiology to various programs or different courses in the faculty at that stage. And those would include biomedical technology students, emergency medical care students, wellness science students. So I taught a generic subject in various departments. Then we merged with another Technicon, which was Peninsula Technicon in the Western Cape. And we then became the Cape Peninsula University of Technology, combining different programs from the 2 Technicons. Very similar programs. I then stayed at CPUT, that's the acronym for institution, and I then became a head of department, the head of wellness sciences in 2010. Still did a bit of teaching of anatomy and physiology. I then went on to teach a bit of research methods. And from there on, I took on an assistant dean position about just 4 years, almost 4 years ago. And last year, I took on the acting dean of the Faculty of Health and Wellness Sciences at CPUT. So that's where I find myself. A good place because I've been involved in a few departments within my faculty, teaching a common subject and having exposure to the undergraduate qualifications and what goes on at each level. So now I'm in a position where I have to drive various elements. And I think research is one strong element. That's where the different research niches and transdisciplinary research between the various departments now comes in. But teaching and learning is a key priority, and research. And I think it's very exciting to be part of Ubuntu 2024. So I'm very much looking forward to that. A first for us and exciting.
So I know it seems like a crazy question when you've had such a varied journey to where you are now. But what have been your personal drivers for all of that work? I mean, it sounds like an awful lot of work.
I think if it's something you're passionate about, or along the way you may find that, look, this is an area that I want to pursue. So it was reproductive health at UWC. I think the professor at that time, there was a few options that we could. It was cardiovascular, it was exercise physiology, it was reproductive neurophysiology. And I think I just took to maybe the interest of that professor at that stage, Prof. van der Horst. I think he's still around doing research. So that triggered a spark. And it was male reproductive physiology that I looked at various research aspects. And then I started at CPUT and I was still trying to finish my PhD, but I then took on a master's student, my first master's student as well, physiology, reproductive angle. And from there, I just pushed, and then expansion into oxidative stress and diabetes. It took a different angle as well. Expansion, exciting, more masters, doctoral students. I think it just grew from there. So starting out with me trying to get my doctorate, taking on masters, doctorate students, trying to complete my academic commitments to the various departments that I was still involved with. So teaching and you're trying to do research. But I think at university, that is what we need to do. It's just a balance of everything that's on your plate.
But it sounds like through that and through your support and the master's students that you'll have made some real significant steps in our understanding of physiology and our understanding of how the body works, as well as the personal support of those people. It must be incredibly satisfying to that. Do you have time to do anything else outside of work?
Yes, I have 2 young kids. I had them late in life, so they're very young, but they keep me on my toes. And besides that, I'm a runner. After my second baby, I put on a bit of weight, and I thought, gee, I saw a program, Couch to 10K program.
Yes.
And I decided to join a running club to get off the couch and get active. So that was in January 2017. And then by April 2017, I did my first 10-kilometer run, which I never thought I would do. And then in 2018, I did my first marathon, 42K marathon in 2018. And then from there, it was just every year doing 1 or 2 marathons.
Just one or two.
In 1 or 2, in 2022, I did my first 56K ultra marathon, which is a big one for Cape Town. I think this draws people from around the world.
Right, I think I've heard of it.
The Two Oceans Ultra Marathon.
Yeah.
So last year was my first ultra marathon, and 2023 was my second this year. And I've done, even last year, I did my first international marathon in Berlin last year. And I ran my first American one, Chicago, now in October this year. So I fit in the running. I get up early. I do late runs. It's running, it's work, it's research, it's kids, it's family. So it's really a balance and a combination of things. But it's exciting. I think it keeps you on your toes.
That you must have. It sounds like you've got boundless energy, and I'm feeling slightly tired just talking to you. Yeah, but that's
How
fantastic.
long? I don't know.
They the starting to travel around the world and to do marathons around the world is, I mean, that's just amazing, absolutely amazing. Two young kids as well. The I yeah I can't wait to meet you. I've done the couch to 5K. I don't know how many times I've done couch to 5K. I get to do the 5K and then I just sort of I think, oh, I've achieved that, and then several months later I'm back on the couch and I'm thinking, oh, I should probably start again. Anyway, so with TUFH, the Towards Unity for Health, and the Cape Peninsula University of Technology, just what's the synergy between those two things? As I understand, Towards Unity for Health, it's an organization that brings academic organizations together that have got a focus on social accountability in the way that the curriculum is developed. How does the Cape Peninsula University of Technology operationalize that? And I'm thinking about it's about connecting people together, and with a particular focus on health and well-being. How does the Cape Peninsula University of Technology do that?
So we have various research niche areas, and one within our faculty is cardiometabolic health, risk factors, and we go out into a community or various communities where they look at diabetic screening. There's research involving schools and various communities. So I think we definitely, it's hypertension, diabetes, epigenetics, inflammation, hematology. So we even do various types of screening, blood donors, red bone marrow drives. We've had a drive this year. So I think that fits in well,
Yeah.
having our link to various communities. We have now, 1st of November, employed a transdisciplinary staff member to assist us with transdisciplinary research, bringing in research elements from the various departments. And I know he's doing a project in schools, risk factors, etc. So I think we definitely can expand on the school research opportunities and then going out into communities and expand that as well. So I think it fits well into the Ubuntu theme. It's what we do, it's what we're passionate about, but I think we can look at expanding on those avenues as well. So we do have staff with their various research projects, postgraduate students, the various areas, and I think that touches on nicely. We also have a research area on rooibos, and they're looking at the effects of rooibos on cardiac risk factors as well.
Oh,
And
that would
then
be
also rooibos, rooibos as an exercise supplement. We're also undergoing some research in that area as well. So
cool.
very exciting. You know, it's an indigenous tea to South Africa. So there's a bit of research on rooibos as well going on in the faculty. So it's exciting.
If anybody listening hasn't had any rooibos, then do try it out. You can get it here in New Zealand. Hopefully you can get it all over the world. It's really nice tea. I drink it because it's a nice tea. But it'd be fantastic if it's got some other health properties.
Benefits, for sure.
Yeah. So I gather your faculty, your university teachers dental sciences, paramedics, nursing services. You talk about radiology, the ophthalmic sciences, as well as the wellness sciences, and was there another one as well? There was a
7 departments. So it was biomedical sciences. Did you
biomedical sciences? Yes, as well.
That's the 7. So those are the 7 departments.
Yeah, I mean it's pretty comprehensive. And are you looking to expand any of those or into new things in the future?
I think for sure. Look, our medical imaging, we offer 4 disciplines there. So I think we cover the various bases,
Yeah.
diagnostic, your ultrasound. Then our nursing, we nursing and radiography go up to DTech level, doctorate level. Those go up to doctorate. Actually, the nursing, doctor of nursing, we're waiting for approvals on that, I should say. But the
Right.
plan for nursing is to go up to doctorate. Then our biomedical sciences and our they go up to doctorate level. I think there we were looking at bioinformatics. So we're looking at a possible bioinformatics there. Our emergency medical sciences, we offer from a higher certificate. We offer diploma, we offer bachelor degree, we offer up to a master, we offer now also going through the external process for a doctorate in emergency medical care. Then our wellness sciences is a smallish department, and I think that department is scope to expand. So we still have to do some work to see how we can expand, whether it's chiro or um, kinesiology or whatever else. There's room for expansion there, I see it. Then our ophthalmic sciences is another small department, and they offer optical dispensing. So those students are trained to do the prescriptions and lenses and glasses for individuals. And we used to also offer either eye clinic where communities would come in and we would do the scripts and do the lenses for needy communities or public that really underprivileged. Um, so that was really exciting. I'm just trying to think our other departments that are covered, emergency medical care, radiography, biomedical. So really we try and we're growing to go up to doctorate level. And then where we can expand programs, we are going to work on that next year. I think that's a goal 2024 to expand our suite of programs. Our dental technology, also an exciting one. And I think the movement to digital dentistry or digital, not the normal impressions. I think we need to move with a digital era and age and try and look at a program in that moving
Digital
those lines.
dentistry sounds
The
fantastic.
digital.
Sounds amazing. Yes. I've got a picture in my head of what that might be, and hopefully in Ubuntu 2024 I might find out a bit more.
I think that we definitely can present
Yeah,
something on that. I'm sure.
that would be fantastic. So tell us about Ubuntu 2024 and why people should come. What would draw people into to attend the conference in Cape Town?
I think besides Cape Town being a must-visit destination for anyone in the world, I think some people have a perception of South Africa being very rural, which there are elements of that, but I think Cape Town is the best part of South Africa. So people must visit Ubuntu.
An unbiased opinion.
No, really, I've been to a few places around the world, and Cape Town, I mean, is home for me. It's it's like no other. You have the mountains, you have the sea, you have the vineyards, and it's really a combination of everything that is on offer. So I think besides Cape Town being the destination of choice, it's a place that people must visit. I think it will be exciting in the sense that it will draw the 4 big institutions in Cape Town together. So we'll unite at Ubuntu 2024. And then obviously listening to the various research that's been done at the various institutions, the various offerings. And I think that dynamic and that dimension is exciting. So for us as CPU to be on board with that, it's exciting for our staff to work towards presentations at Ubuntu, our rooibos, our digital dental, etc. So we will have quite a bit on offer there. I'm going to push for staff presentations and just to get people to know about what it is CPUT does. So it's a platform to present what we can do, what we offer, and exciting. I think it's a conference. I've never been to an Ubuntu conference, so it's also going to be my first for me and a lot of the staff. So it'll be exciting to first to get exposure to the offerings that Ubuntu. But I'm so looking forward to this conference, uniting the 4 universities in Cape Town on a platform. It's going to be exciting, and then I definitely want to encourage anyone from around the world to be part of this, where we unite people, health, what's done across Cape Town, and yeah, an exciting opportunity. So I'm quite excited. I think 2023 has been a hard year for me. It's been, I think, one of my most taxing years ever, I think. And you're just trying to make it to the end. There's so much you have to push. And I'm quite glad I got to end of the year speaking to you, because I thought maybe, you know, I need to do this next year time-wise, but I'm glad I'm here, excited to kick off 2024 as we prepare for Ubuntu 2024.
Thank
Very
you.
excited.
And yeah, no, I'm really, really looking forward to it. Thank you so much. So if you want to find out more about Ubuntu 2024, then visit the website ubuntu2024.com. And Nicole and I both hope to see you there. Thank you. Thank you, Kakite Eno.
Thank you.